Hello, my name's Prasadu. This is the name that I was given at my ordination in June 1994 by my private preceptor, Ratnaguna. For some years, both before and after ordination, I practiced karate. First in the tradition of Kyokushinkai, and then later in Shotokan. And as you know, martial arts like karate have a system of coloured belts, the grading system. And sometimes people mistakenly see the belt colour as signifying some kind of status. But our sensei said, no, that's a mistaken view. The colour of the belt simply identifies what can be expected from the wearer. So consequently, someone like me, who was a first dan black belt, also known as a shodan, we can be expected to have achieved a certain level of proficiency and to be able to display that competence. And similarly, in our order, someone wearing a kesa can be expected to be going for refuge effectively. And we ought to be able to see that in their behaviour and their speech. Why am I telling you all this? Well, I'm telling you this because I think it relates to my experiences of working in the health service during this COVID-19 pandemic. In September of this year, I will have achieved the milestone of having been employed by the NHS for 40 years. My job titles are Consultant Clinical Psychologist, Director of Psychology Services, Clinical Lead for Schwartz Rounds, and I'll say a bit more about Schwartz Rounds in a little while. I work for the Calderdale and Huddersfield NHS Foundation Trust, where I'm also an honorary Buddhist chaplain. These titles are nothing to do with status or achievement per se, but simply indicate what others in the trust can expect from me in my work. And I work with all staff groupings from cleaners and porters, all the way across to medical consultants and executive directors. Notice I use the word across, because at the level of being human, we're all of equal status and equal significance. My wife works as a consultant lead psychologist for a specialist mental health trust as well. I have a son who's a clinical lead manager of therapists in an NHS trust in the Midlands. I've got another son who's a junior doctor on a high dependency COVID ward in Greater Manchester, where he tells me that 80% of his patients die. So I think I've got something to say about what it's like working in the NHS at this time. And I'll try and share that with you and how being a Buddhist helps me at this time in my work and also in life generally. We refer often to going for refuge in terms of us wholeheartedly and completely, as wholeheartedly and completely as we can. And we talk about going for refuge with body, speech and mind. I think it can be helpful to reverse this order and talk about practicing going for refuge with mind, speech and body. Paying attention to what we are aware of in our mind, in particular, our thoughts and emotions. How we're communicating with our speech, emails, Facebook, posts, Twitter, and all the rest of the way that we communicate with other people. And our body, how we act, how we behave. As the Dhammapada puts it, I'll just quote directly from the first two verses. Mind precedes all mental states. Mind is their chief. They are all mind wrought. If with an impure mind, a person speaks or acts, suffering follows him like the wheel that follows the foot of an ox. Mind precedes all mental states. Mind is their chief. They are all mind wrought. If with a pure mind, a person speaks or acts, happiness follows him like his never-ending, never-departing shadow. And I try to recollect these two verses as a daily practice. The other daily practice that I actually think is very fundamental and something that I try to do whenever I can, and that's to practice gratitude. I recollect daily the many things that I can be grateful for. Just to name one or two, I have the extreme good fortune in living in this country at this time with a world-leading healthcare system, the NHS. And we in the NHS appreciate the Thursday evening expressions of thanks for what we're doing. And we are doing a lot. Not just working hard, but in many cases up and down the country, literally, there are people risking their lives for you. But standing in the street applauding, while it's appreciated, it's not really what we want you to do. What we really want is that you follow the government and NHS advice and guidelines, which is unambiguous and crystal clear. Stay at home, protect the NHS and save lives. Staying at home, unless for the handful of exceptions that we all know about now, is maybe not too much to ask, even though it's hard. It means what it says, and the exceptions don't include meeting with friends or relatives who are not living in your household. In fact, at this time, it's unlawful to do so. I've heard relatives of people who died from COVID making tearful pleas, beseeching the public, please do stay at home, keep your distance. And they're heartbroken. I've also had to listen to frontline staff express their fears and anxieties about going to work. And more than once, I've heard somebody say that they were actually terrified about the prospect of going into work. And yet they do. But as well as feeling scared and anxious, I hear a lot of anger in people, a lot of irritation. People get very frustrated and really cross when they don't see that everyone is, in a way, doing their bit. They get irritated and angry if they can see people on their trip to and from work, or they know about people where folk are not really following the advice that they've been given. And the advice is only there to keep everyone safe, and in particular, these people that are going to work on our behalf. So please, don't just say thank you, but demonstrate it. Demonstrate your gratitude by acting in the ways that you know you should. We are immensely grateful, those of us in the NHS, for everyone sticking to the rules, all the people that, at great cost to themselves, and I know it's really tough, but we really are grateful for when people are doing what they need to do. And that's something that I also recollect in my daily practice. It's become much, much more of late to act with compassion towards one another and to show that in whatever ways we can, we appreciate others and we're grateful towards other people and their acts. And sometimes, because we're restricted in what we can do and where we can go, we've got an opportunity, actually. We've got an opportunity to have a look at the perfections, the 6 perfections, also known as paramitas, and to try and work out how we can practice them at this time. The 6 perfections are dana, generosity, giving; sila, morality; right conduct; shanti, patience and forbearance; virya, energy, effort and attentiveness; dhyana, which is usually translated as meditation, but it really means absorption and developing absorbing and absorbed mental states, but meditation will do for now. And prajna, wisdom, wisdom and understanding. And I'm personally finding the practice of Shanti helpful at this time. And in the context of mind, speech, and body, this is what I try and do. I try to cultivate a mindset of calm tolerance, patience, and a degree of forbearance with unpleasant mental states. Noticing when angry thoughts arise, for instance, reminding myself that they're only thoughts. I don't have to act on them. I don't have to give them too much house room. I can leave them. I don't have to let them grow by following them and engaging with them. I can just observe them, notice that they've arisen, and then let them be. With speech, I can look out for how I'm actually speaking. Not just the words I'm using, but the tone of my voice, what I'm saying, and maybe whether I'm speaking too quickly and in a reactive kind of way. Maybe I could put myself on pause for a little before I just react so that I can respond and speak in a harmonious, helpful kind of way. And then thirdly, the body. I can check in with what my body's actually experiencing. How is my body feeling? Am I physically tense? Could I relax a bit more? How is my breathing? What am I physically aware of other than my breathing and how tense my muscles are? What about other bodily sensations? I can notice the pressure of the clothes on my body. I can notice the difference in temperature, perhaps between my chest area and my hands. If I'm outside, I can notice the air on my skin. And practicing in this way, with Shanti in mind, I find that to be really helpful in relating to other people and letting go of irritation and annoyance and anger that bubble up sometimes in the day. When I don't like someone else's behavior or I don't like somebody else's expressed views, well, I can practice Shanti. The last thing I want to share with you about currently working in the NHS is something called Schwartz rounds, which you remember I mentioned earlier, and I'm the clinical lead for our trust. In brief, these rounds are events that are put on for staff in order to get together and have an opportunity to share how their work is affecting them emotionally and affecting them socially and in the rest of their lives when they're not at work. I won't tell you all about the format and how we run them, but I will tell you how they came about in the first place. In November 1994, a 40-year-old healthcare lawyer was diagnosed with lung cancer. His name was Ken Schwartz, and he was an otherwise fit, healthy, non-smoker with a young family who lived in Boston in the States. Over the coming months following his diagnosis, he was treated with chemotherapy, radiotherapy, and various surgeries. In July 1995, he published his story in the Boston Globe magazine. And he noted two significant things over the months that he'd spent in hospital. And he wrote the following: "If I've learned anything, it's that we never know when, how, or to whom a serious illness will strike. If and when it does, each one of us wants not simply the best possible care for our body, but for our whole being." He also noted that as well as all that he went through and all the difficult times and the painful treatments, his ordeal was, in his words, punctuated by moments of exquisite compassion. "I've been the recipient of an extraordinary array of human and humane responses to my plight. These acts of kindness have made the unbearable bearable." That's worth repeating. Making the unbearable bearable. Ken died just 2 months later, but not before he'd founded a centre in his name dedicated to promoting compassionate healthcare. And a legacy of this has been the establishment of the Point of Care Foundation in the UK that franchises Schwartz realms to organisations like NHS trusts for the benefit of the staff who work in them. And I'm pleased to have been a part of them being established in our trust. It's so important, fostering, encouraging, developing and maintaining compassion towards others. It's a fundamental characteristic of what it means to be a Buddhist. Being a Buddhist means following the teachings of the Buddha, aspiring to achieve what he achieved, and seeing that ultimately wisdom and compassion feed into each other until they merge together as two aspects of the same thing. And today, as we celebrate the birth, enlightenment and parinirvana of the Buddha, in this week of the full moon of May, traditionally known as the flower moon, we could reflect on another couple of verses from the Dhammapada, which appear in the chapter of flowers. Like a beautiful flower, full of colour, but without fragrance, even so, fruitless are the fair words of one who does not practice them. Like a beautiful flower full of colour and also fragrant, even so, fruitful are the fair words of one who practices them. Happy Buddha Day.